Maria Manuel. I'm your student nurse for today. I'm from Southwestern University, FINMA. And can you excuse me for a while? I will just wash my hand.
Okay.
Okay, thank you. So I'm working with your doctor today, and as a student nurse, I will be sharing all of your information with your doctor because she will be working with you to plan your care. So what brings you to the doctor today, ma'am?
I have stomach pain.
Stomach pain. Is there something else you wanted to speak with the doctor today?
None.
Okay. So I'm going to start your evaluation by discussing your history. So let me just summarize what I just heard. Please correct me if anything is wrong or incomplete. So you're here today due to stomach ache. Is that correct?
Yes.
Okay. So what is your name?
This guy around
Okay. So Miss Manuel, how old are you?
14.
Okay. So could you show me specifically where you're feeling this stomach pain?
Here.
Okay. Does it seem to go somewhere else?
No.
How do you describe this stomach pain? Is it like crampy, achy, dull, intermittent, or sharp?
Crampy.
When did this problem start?
Yesterday.
How long does an episode last?
5 minutes.
Okay. How often do you get this in a day or a week?
Every day.
Since it started, has it been getting worse or better?
Worse.
In what way is it changing?
It's getting more painful.
So what were you doing when this problem first started?
Eating.
What makes the problem worse?
When I'm defecating.
What makes the problem better?
When I'm done defecating.
Okay. Do you have any other symptoms?
Yes. I have fever and diarrhea.
Do you think this other symptoms is related to your stomach pain?
Yes.
Have you ever had anything like this before?
No.
What do you think is causing this?
My period.
What worries you about this?
None.
How is this stomach ache affecting you?
It bothers me.
So how does it interfere with your daily activity?
None.
Okay. How about your relationship with others, your thoughts about yourself?
No.
Okay. I have just gathered information about your stomach ache. I'm now going to ask you some different questions that is related to general information outside of your symptom. So, how is your ability to do things around the house or nearby? Do you have any difficulty in driving, cooking, or using your medication?
No.
How is your ability for personal care? Do you have difficulty in bathing, dressing, or grooming?
None.
How are you doing with your school? Are you having any problems?
No.
Okay, now I'm gonna ask you about your medical condition and health. In general, how would you rate your health? Excellent, very good, good, fair, or poor?
Good.
As an adult, what medical condition have you been told you have?
None.
Has anyone ever told you that you have high blood pressure?
No.
How about diabetes?
No.
What medical conditions do you have?
None.
What medication do you use?
Biogesic and dietary.
Okay, what do you use that for?
for fever and diarrhea.
Okay. What is the dose?
500 milligrams of Biogesic and 2 milligrams of Diatops
Okay. How many times a day do you take it?
every 4 hours.
Okay. Do you think it is effective?
Yes.
Okay. So do you think you are having any side effects?
No.
So what vitamins or supplements or home remedies are you using?
I don't have any.
Besides medication, what do you use for your medical condition?
None. I just hydrate myself and get some rest.
Are you allergic to anything?
No.
Have you ever been hospitalized?
No.
Have you ever had surgery?
No.
Have you ever had any accident or injury that needed medical care?
No.
Have you had blood transfusion?
No.
What illnesses do you have as a child? Do you have chickenpox, measles?
Chickenpox.
How old were you when you started your period?
11.
Are you still having your period?
Yes.
How many times have you been pregnant?
None.
Over the past 2 weeks, have you often been bothered or feeling down, depressed, or hopeless?
Yes.
Over the past 2 weeks, have you often been bothered by little or no pleasure in doing things?
Yes.
Do you regularly have your blood pressure checked?
No.
How often do you do that?
When I feel sick,
What were the results?
they were always normal.
Have you had a tetanus shot in the last 10 years?
Yes.
When?
Just years.
Have you had 3 shots of hepatitis B?
No.
Do you get the influenza vaccine once a year?
No.
So, we're done. Now I'm gonna ask you about your family's health. Has anyone in your family had stomach ache with diarrhea and fever?
No.
Tell me about your parents. How old are they? How would you describe their health?
My dad is 45 and my mom is 42. They both had good health, but my father has hypertension.
Tell me about your brother or sister. How old are each of them?
I don't have any.
Do any medical condition run in your family, such as high blood pressure?
Yes, my father has hypertension, as I mentioned earlier.
Okay. So now I'm gonna ask you about your personal background. What is your highest educational attainment?
High school.
What languages do you speak?
English, Bisaya, and Tagalog.
Which language do you prefer?
Bisaya.
Are you married?
No.
Who do you live with?
My parents.
What type of home do you have?
Apartment.
What do you do for a living?
None.
What other jobs had you have?
None.
Do you have any financial concerns about your home, food? Do you have any financial concerns about your healthcare?
No.
Do you use any tobacco products?
No.
How much alcohol do you drink?
I don't drink alcohol.
Do you use any recreational drugs?
No.
Have you been sexually active in the past?
No.
Tell me about your diet.
I don't have a diet.
Okay. What do you do for leisure or to relax?
Sleeping.
What do you do for physical activity or exercise?
None.
Do you feel safe in your relationships?
Yes.
Has anyone physically hurt you?
No.
Okay. How does your religion or spirituality influence your healthcare?
It strengthens my courage to fight whatever disease because I know I have my God with me.
How often do you wear a seatbelt?
I don't.
How often do you use sunscreen?
Every day.
Do you have any weapons in the house?
Yes.
What type?
Kitchen knife.
Do you keep this locked up or out of reach for the children?
Yes.
Do you have a living will?
No.
Okay. So that's all for today. You may now go. Thank you for your time.